and one of the industry's premier thought leaders in this space, representing one of the top exchange providers in this space. It's Jeff Yaniga, Chief Revenue Officer, Maestro Health. Jeff, good morning.
Hi, Doug. Good morning, Ron.
Hey, good to have you here, Jeff. Good to have you on the program. For those of our audience who may not know about Maestro Health, which is probably very few, but just give a little background on Maestro Health, please.
Yeah, sure. Thanks. So at the heart of it, Maestro Health is an employee health and benefits technology company, and truly a technology meets service model. And our clientele is brokers, employers, and carriers. And from a high level, we call our platform All In, and we call it that because it brings a lot of things together. And under one roof, you work with one partner, one service team, one platform, and one portal. And within that portal, we have four primary pillars. The first is a benefits marketplace, a traditional private exchange, both large and small group, that personalizes the shopping experience. The second pillar is an HR management suite. And the HR management suite includes Ben Admin and other things, but the comprehensive technology and service is built to reduce administrative costs for HR reps and serve compliance needs as well. And we're also adding onboarding and offboarding capabilities too. And the third suite is our benefits accounts, which more traditionally defined as HSA and FSA. And with that technology, an employee can choose, access, and manage their accounts year-round. And then, Doug, I think one of the ways that we're different, considerably different from others, is that we have a self-funded insurance product as well. Yep. While all of our technology is agnostic to funding strategy, we do have a full-service claims administration and care management suite that's people-friendly and it's CFO-friendly as well to reduce costs.
Hey, Jeff, thank you, Jeff, for that. And you just talked about it in kind of your overview too. But let's get a little more granular on it because I think at the heart of all this is the importance of personalization for both the employer and the employees. Talk more about that, if you would, please. The importance of that.
Yeah. So there's a lot of ways that personalization comes into play, and I think it's hard to imagine getting more personal than choosing one's physician. So one of the areas of personalization that we're working very closely on and we're deploying with Blue Cross Blue Shield of Arizona as we speak is what we call Shop by Doctor. One of the first things that employees respond with when they're talking about their benefits is, can I keep my doctor? And the technology allows them to input their doctor and then retrieve a plan list where that doctor is included. So we found that to be at the heart of personalization. Secondly, from the shopping perspective, personalization is playing a huge role in healthcare. As you look at other ways that it's a part of e-commerce as a whole, I know I logged on to my wife's Amazon.com account the other day because she has Amazon Prime and I don't. After logging onto mine, the products that are presented to her are very different than the products that are presented when I'm in my account. And Amazon's been really smart at being relevant and timely with what they show. And I think that healthcare is following that trend. And the technology companies that are able to make the shopping experience relevant for the beneficiary are the ones that are comfortable to use. And comfort matters when it's such an important choice.
Yeah, and an exchange environment, like yours, gives the employer the ability to also better educate their employees on what choices they can make. Correct?
Yeah, it does, and education is becoming more and more important. There's plenty of data out there about the number of bankruptcies that are caused by medical expenses, and I don't think that's going to change, Doug. Some of the education paths that those of us in the industry continue to seek are obviously transparency, and transparency's come a long way. Today, it becomes much easier for someone to attach quality of a service to the cost of a service. We still have a long way to go, but private exchanges enable that. And it'll be interesting. I don't know if you agree, but I think that if we stick a pin in today's date and imagine even how much better those tools will get this time next year, I think we're in a seismic shift.
Yeah, we are, and if we think about where we've come in such a short amount of time too, and where things have changed, right?
Yeah, it's amazing. It's amazing how fast the market has evolved. It's interesting. My colleagues here give me a lot of grief. I'm a lot of fun at cocktail parties because literally sitting next to me here is about a 60-page document, and it's written by the National Bureau of Economic Research. And one of the things, it's a great read. I think it's written for insomniacs, but there's some really interesting data points in it, and to hit your question about evolution. So it talks about how much choice has been enabled in the private exchange market and the value of that, but it asks all of us to consider the effects of literacy when that much choice is available. And they posit that there's a literacy crisis around this healthcare insurance decision making, and I think private exchanges have a very important role in that evolution. And exchange models must educate employees on what some of the basic terms mean. Now, some people will move right past that, but if you don't understand fundamentally what a premium is or what a copay is, or what a deductible is, if you don't fundamentally understand that, more choice could actually cause a problem. So I think that exchanges have a responsibility in this evolution to serve that need.
Yeah, I mean, you become the epicenter for, that education to take place, and so very, very important. I mean, we can't all at once say you are now a healthcare consumer to employees and their families out there without giving them the tools and the education and staying close to them, both the exchange providers, the brokers or TPAs that you may be working with, the consultants and the employers that themselves, because they've never had to be consumers before.
Yeah, it's funny. I think my parents, who I'm very fortunate, are alive and healthy in their early 70s, which I'm sure my mother would love that I just mentioned that. But their generation had full transparency into the cost of healthcare. They presented their card and they wrote a check for $10. I mean, we could even chuckle at the fact that checks were written at some point in our existence. But how different has it become? Those days are over. And I'll say that there are probably still a lucky few that have a plan where all they know is a $10 copay, but fairly certain that the Cadillac tax will take care of the rest of those. So today's generation and having recognizing the importance of benefits literacy, I think, is key.
Yeah.
And so,
absolutely.
Just to build on that a little bit, I think the classroom for benefits literacy are benefits marketplaces. And to your point, Doug, the tools that exist to help people use their insurance card.
And it's there, and it's going to be there with the consumer 365, 24/7.
Yeah,
right?
It is. And so harking back onto the evolution of private exchanges, and probably for both of us, that might even be funny to say or hear, as you and I we've watched the private exchange landscape evolve over this 2 or 3 or 4 year period.
Yeah.
And during that time, we've seen some trends that are almost impossible to ignore. And one is obviously high deductible health plans, huge tailwind, and I think that's going to continue. And I think that the consumers are starting to realize that if they have a high deductible health plan, that the decision they made on day one, the other 364 days are equally as important, and utilizing their benefits. So it's one of the I was having a conversation with one of my friends who was in a high deductible health plan for the first time. I couldn't believe it. And they're asking for an explanation. I said, well, imagine that you now have a debit card, and the debit card has $2,500 of your money on it, and you have to choose how to spend that. Spend it wisely and figure out the best services you can get, and how to get the most bang for your healthcare buck. And I think a lot of people are going to learn that lesson over the next couple of years.
Yeah, I do too. Jeff, as you come out of this 2016, open enrollment period, and you look ahead to 2017 plan year, which the planning is taking place right now, what do you see for the market right now moving ahead near term, meaning 2017 plan year?
So I think a lot of us watched and a lot of us participated in the education of brokers and employers in 2014 and 2015 about what exactly was a private exchange and what benefits do they derive. And while the argument still continues, and it will continue, exactly what those features and functionality are, I think most of the people that are active in the business now get it.
Yep.
The adoption curve hasn't fully hit yet, but if estimates are right, we're at 6 million people. I think in 2017, there's an enormous adoption uptick. And the people that are adopting are the ones that are thinking ahead. They're thinking ahead to January 1st of 2018 and the Cadillac tax coming into play. Now, obviously, legislation and the presidential race are things that we all have to watch very closely. Yep. And I guess many of us think that there probably will be changes made. But that said, if there aren't, a private exchange model offers a bit of a opportunity to start to blend people into this defined contribution model where it will become mandatory next year.
Yeah, Jeff, I absolutely agree with you 100%. There's some in the industry that think the Cadillac tax concern will take particularly employers' eyes off the ball and not have them look at exchanges. I tend to agree with where you're coming from, that it kind of gets them to look at it as a more real option that they should seriously consider because of the impending Cadillac tax.
Yeah, I'm with you, Doug, because I think that the innovative so the role of the broker has evolved so much, and yep. The innovative brokers are coaching their employers to say, if you're going to have to do this for the 2018 election season, some conditioning will make that transition more graceful if you do it in the election year 2017. So I think the innovative consultants see private exchanges as a way to brand this change as one that can be positive or at least not overwhelmingly negative to the employee.
Yep. Yeah, I think you just reiterated today, and you said it before, and I actually use your words, so I hope you don't mind. But to your point, I mean, brokers and employers both are kind of graduating right now from private exchange school, and those are your words, not mine. And I think that's well said. I see, and I think you and I have talked to it before. When I look at the market and I see the 500 employee to 3,000 employee market space, I see that as a pretty fast-moving, embracing market over the next year to 2 years. Do you agree with that?
Yeah, I do, and that's our target market, and for a lot of reasons, but and not the least of which is if you think about the human resource staff that exists within groups that size. They may be among the most taxed in the industry or in the landscape. Yep. They're large enough that they have a large, diverse employee set, but they're small enough that when they ask their CEO for more money, the CEO says the budget's not there. So as yep. such, the HR executives in that group, especially that size of group, especially, are more challenged than ever administratively. And exchanges can provide administrative burden. Right. And throw the ACA in, and now you need relief from compliance burden too.
Yeah, you do. And you also, the HR benefit leaders in those size companies also have more of the ear of that CEO and CFO as well. There's more of a closer connection. Wouldn't you agree with that as well?
Yeah, and the almighty dollar, I think, is one of the big reasons. If you look at almost any balance sheet, one of the most expensive elements on the balance sheet is employee benefit costs. Yeah. And it's fascinating. So what I love about our jobs, Doug, is that we have exposure to so many different kinds of employers, and there's so many unique needs. And it's interesting. This may be unfair, but before private exchanges, a lot of benefits managers had to take a draconian approach, and the choice was defined as yes or no. You either want benefits or not, and to try and box and fence employees as all the same, or employers are all the same, and one size fits all, and benefits were broken. And I think there's an opportunity to fix that.
Yeah, I think so too, Jeff. Hey, like always, time flies too quickly when we have you on, and always enjoy your thought-provoking discussion and really appreciate it. And to our audience, before I let you give some takeaways, I want to remind our audience that you can join Jeff and his team with us at Private Exchange Forum in Dallas, February 23rd, 24th. They will be there with us, and we appreciate their participation with us. Jeff, leave our audience with a couple takeaways, if you would, please.
Yeah, so I'm biased, so take this for what it's worth. But I think the shift to private exchange isn't an if anymore; it's a when. And I think that's because of the work that you guys do and others around consumerism. And customers demand choice. They demand shopping in a way that suits their needs, whether it's online or telephonically or a benefits meeting. And I think education remains a key. I think as people start to have a big impact of high deductibles or narrow networks, and they learn their doctor's not covered anymore, teaching them before they learn the hard way is a responsibility that exchanges must serve.
Yep. Well said. Listen, thank you again, Jeff, very much. You and your family and the rest of the team there at Maestro have a great holiday, and let's all have a great New Year.
Yeah, you too, Doug. Thanks so much.
Take care, Jeff.